Good afternoon, and thank you for joining Louisville's Health Spot, bringing you up-to-date research on the latest healthcare advances. My name is Samantha Gullett, and today we will be discussing alternative medicine and the role it is beginning to play in the Western healthcare setting. When you think of alternative medicine, what comes to mind? You may think alternative medicine is this, or in your mind, you may be even thinking this. You may think that it is relegated to people who don't practice real science. However, it's proving to have a large impact through multiple studies done in the Western healthcare setting. I have the CEO of Sutter Memorial Hospital here to explain to us the impact of probiotics on antibiotic-associated diarrhea and the spore-forming bacteria Clostridium difficile, which both are constant problems in the healthcare setting. And to tell us more about the implications of the problem is our first guest, Samantha Burger, from the local hospital, explaining more about the topic of discussion.
My name is Samantha Burger. I am the CFO of Sutter Memorial Hospital in Louisville, Kentucky. Our hospital has recently been looking into probiotics and their effect on antibiotic-associated diarrhea and Clostridium difficile, which are becoming growing concerns related to healthcare spending, morbidity, and mortality. The spectrum of severity of C. diff can range from diarrhea to sepsis, which can lead to death. This current and escalating problem may be due to new resistant strains of C. diff. Transmission of C. diff occurs primarily in healthcare facilities by the fecal-oral route following contamination of the hands of healthcare workers and patients, and is almost always associated with antimicrobial use. Patients with C. diff remain in the hospital an average of 3 to 6 days longer, with each patient's stay resulting in additional hospital costs averaging $3,669 per patient day. A conservative estimate of the cost of this disease and its management in hospitals are estimated at $3.2 billion per year. As a hospital, we have been looking at the use of probiotics and their impact on the astronomical costs associated with antibiotic-associated diarrhea and Clostridium difficile. Extended hospital stays, readmissions, and higher hospital costs are just some of the consequences of this issue. We're applying current research into practice related to probiotics to patients receiving antibiotics and see promising results so far.
Thank you, Samantha. Now let's speak to a research specialist who has studied the effects of probiotics in the healthcare setting.
Thank you, Megan. Probiotics are live microorganisms, in most cases bacteria, that are similar to beneficial microorganisms found in the human gastrointestinal tract. They help keep the intestines healthy and assist in digesting food along with reducing the risk of colonization by pathogenic bacteria. Research has shown that some digestive disorders happen when the balance of the friendly bacteria in the intestines becomes disturbed. This can happen after an infection or after taking antibiotics. Research has performed a systematic review and a meta-analysis which evaluate the efficacy of the co-administration of probiotics in preventing antibiotic-associated diarrhea and C. diff. The meta-analysis showed that administration of probiotics led to statistically significant reduction of 44% for antibiotic-associated diarrhea and 71% for Clostridium difficile.
Thank you, Caitlin. Maybe alternative medicine isn't as radically opposed to Western medicine as we once thought. Give us your input at louisvilleshealthspot.com.